To understand lymphedema, you need to know what your lymphatic system actually does. So think of it as your body's drainage system. It moves excess fluid and waste from your tissues back into your bloodstream. Lymph nodes then act like a filtering station along the way. When cancer treatment damages or removes lymph nodes and vessels, mainly through surgery or radiation, that drainage system really can't keep up. Fluid builds up in the tissue, gets stagnant, thickens, and causes swelling to get rid of. That's actually what true lymphedema is. There are different types, which we're getting ready to talk about. You have primary, which is very rare and it's genetic and it occurs pretty early in life. Secondary lymphedema is caused by something else. Most of you are dealing with secondary because it's related to your cancer treatments. Lymphedema is a bit of its own category, however, is still classified as a lymphatic disease. I posted resources below for more information since it's beyond the scope of this talk. However, it can be extremely frustrating to manage and is often overlooked. Axillary cording is another lymphatic disease that doesn't always have swelling. This is discussed in actually a few of the longer videos because it's way more common, more debilitating, and can be quite painful. Another often overlooked issue is what's called radiation fibrosis. Now, this is not classified within the lymphatic disease spectrum. However, it's something that I also added a few videos on because of how important it is within the scope. Again, it's very limiting. Your tissue that's been irradiated becomes very thick and stiff and scarred. But again, I want to make sure that you know it's not a lymphatic disease, but definitely discussed extensively. So this may sound like a lot, but remember, you don't need to remember all of this right now. Feel free to use the references and added videos to help retain this. In the end, here's what matters. Lymphedema is chronic, meaning it doesn't go away, but it is manageable with the right approach. Now, the next thing is, how do we treat it?